Great. Thank you so much. So you were talking about obesity and character in part of your presentation. How do you find who are obese are treated by doctors? Does their obesity status affect the way doctors see them and the way that they prescribe medication and treatments to them?
Yeah, I mean, historically it's been absolutely deplorable. And there have been egregious errors in one of two directions, if not both. So one direction is victim blaming. So you basically have a patient with obesity and many other things, and every medical report is about this person's obesity as if everything else is just their fault. It's completely deplorable. And I don't know whether that's a byproduct of something deep in human nature or if it is medical impotence, the fact that medicine is so bad historically at helping people manage their weight, that the frustration results in this response. I'm not sure what the exact psychological reasons are. It's probably a combination of those things, but deplorable. So obesity becomes the story about this person, and implied often is, they're lazy, they're gluttonous. So it's quite deplorable. But in the other direction, it's completely ignored. So I did a lot of medical education in my career. I taught medical students. I was a residency director. So I used to do what we call morning report. So you're in the hospital, you're managing a group of residents. All the patients that get admitted the night before are presented to you. You do ward rounds, so you see the patients. But there were instances where I'd see a patient and this person, had a BMI well above 40. They weighed over 400 pounds. And because of the awkwardness of dealing with obesity, the resident presenting the case would talk about their health condition and omit that. There'd be no mention of the fact that their weight was clearly a significant driver of many of the things we were trying to address. So either it's maligned or it's ignored. And both of those are bad because, we neither blame the victims of coronary disease nor fail to talk about it, right? I mean, we need to be able to address something with competence and compassion. So those historically have been the problems. And again, that AMA decision years ago to make obesity a disease was an attempt to legitimize it medically so that doctors would do a better job. Sadly, I have not seen, in my experience, a lot of progress yet. I'm hoping there will be more. But in order for there to be the right kind of progress, we need everybody to understand that the root causes of obesity are not in human character. They're not in some pandemic change in willpower or self-control or personal responsibility. They're not in a change in the choices people are inclined to make. They reside in the realm of the choices that people, and we've completely changed those choices in the food supply, and we've changed them in terms of daily schedules, and we've changed them in terms of labor saving technology. That's where the changes are. That's where the problem resides. And I think that's extremely liberating for provider and patient alike, because we can say, this is not your fault. If you'd been born 100 years ago, you'd probably be lean. If you lived in a different society, you'd probably be lean. You're here, you're mired in all of these obesogenic influences. Now, does that completely exonerate you from playing a role in doing something about it? Clearly not. Every aspect of your health depends as much on you as on anybody else who's involved and part of your team. But it does take a village, and we need to address how you interact with this obesogenic environment. And you need to be empowered with a skill set so you can succeed. It then falls to you to put that skill set to good use, but we absolutely need to get you skilled up. It can't just be about your willpower. And yes, it's important because your weight is contributing to inflammation and your coronary disease and your diabetes and your hypertension. And it's my job to help protect your health. And if your weight is contributing to bad health, then it's important to me in just the same way that your blood pressure would be if it's contributing to bad health, or your cholesterol if it's contributing to bad health. It's my job to help protect you and empower you with various means to protect yourself. So, the conversation is not difficult to have if you think about it right, but it unfortunately doesn't happen very often.
So, as part of the body positivity movement, there's an idea of obese, healthy people. Is there such a thing? Can you be both obese and healthy, or even if your signs aren't horrendous while you're obese, you'd be healthier if you were less obese?
Yeah, so excellent question. And actually, this came up just recently There was a spread in the Washington Post about the anti-diet movement, which really originates with the health at any size movement, which in turn shares some of its legacy with the fat but fit concept popularized by Dr. Stephen Blair at the Cooper Institute, among others. The unfortunate reality is essentially, so yes, it's possible, but, and this is a important but. First, in the real world, few people are, because the things that make people really fit, so if you're genuinely fit, they tend to be things that make you less fat. I mean, at the extreme, you look at endurance athletes. They're almost universally very thin. They're the fittest people on the planet. They're very lean. They're not trying to be lean. They're not focused on their weight. They do the things necessary to be really fit. They wind up being lean. Well, most of us are not Olympic athletes, but to a lesser degree, the same is true. If we do the things to make us genuinely fit, which is high quality fuel, a good diet, and routine physical activity, you're going to wind up being leaner than most people around you. So lean and fit simply go together, whereas fit and fat tend not to, because it's hard to stay fat if you're doing things to make you genuinely fit. There are some people who are genetically and metabolically predisposed to weight gain who exercise quite a lot, who are fitter than most people, and yet still relatively fat. And this was what Dr. Stephen Blair spent his career talking about. So yes, it's true, but at the population level, they're a very small set. What's much more common is not fit and fat, or fit and not fat. Those are the bigger cells. Really fit, truly fit, and yet still truly fat is quite rare. And then the second part of the answer is there have actually been studies that have said, well, let's look at that group. Let's look at fit and yet fat, and comparably fit but not fat, and compare metabolic markers between the two. And as you suggested, Michael, there's a distinction there. So in other words, the people who are fit but fat actually do have some metabolic impairments relative to people who are fit but not fat. In other words, they could still be even healthier if the weight were managed. That doesn't mean weight should be the priority. I believe vitality should be the priority. But since weight is an important indicator of vitality and the potential for years in life and life in years, it can't be ignored. So it's not a myth, fat but fit. It can exist in the population, but there are very few people in that cell in a 2x2 table. So fat, yes, no, fit, yes, no. There are very few people in the yes, fat, yes, fit cell. And even those people in that cell would probably be metabolically better off if they could do something to address excess fatness. And that's because adipose tissue is metabolically active in ways that interact with inflammation, and it's an important body tissue, and having more of it than is optimal for your body causes problems.
So thank you for that answer. In your presentation, you were talking about counting calories, or do calories count, and all that stuff. And you mentioned we can follow up with this in the Q&A. I just want to give you the opportunity to speak more on that topic.
Yeah, so it's just a silly distraction over recent years that there have been many commentaries on, is a calorie a calorie? And from my point of view, sort of pseudo erudition, in other words, acting like you're doing some deep thinking about something that's really quite obvious, self-evident, and superficial. So you could ask the question, is a mile truly a mile? Because after all, you could stroll a mile along a flat, sandy beach on a lovely day, or you could walk a mile in a driving blizzard up the slopes of Mount Everest. So is a mile really a mile? Vastly different experiences, huge differences in the effort, the total experience, whether or not you're having a good time. Although I guess mountaineers may enjoy the driving blizzard on slopes of Everest. But in any event, is a mile really a mile? I mean, what a silly question. A mile is a unit of distance. A mile is a mile. It doesn't mean every mile we go in our lives feels the same or requires the same exertion. So calories are a unit of measure. They measure the energy stored in food. And like any machine, our bodies require energy. So is a gallon really a gallon? What if you use high test versus a different form of gasoline? Since they're different, is a gallon a gallon? And, oh, by the way, cars vary in fuel efficiency. So is a gallon really a gallon? Yeah, a gallon's a gallon. it's not the only measure that matters. And in the case of calories, they absolutely, undeniably, irrefragably matter. But who wants to spend their life counting them? And it's a losing proposition anyway, because remember Michael Moss's work, The Extraordinary Science of Addictive Junk Food. You are mired in a food supply willfully engineered by highly paid, highly trained, really smart people to make it damn near impossible to stop eating if you eat the wrong things. But all fixable if you eat the right things, because there are many virtues to wholesome foods, mostly plants. Among their many virtues is they fill you up on many fewer calories. So you essentially sidestep that entire problem. So calories count, but I've always had the same antipathy I think most people do to spending a lifetime counting them. I don't think we need to do that. I've never counted calories, by the way. I weigh, I think at this point, because of the age-related muscle loss, I weigh a bit less than I weighed when I graduated high school, but my weight fluctuated in a very narrow range my entire life. I'm not special metabolically. In fact, I gain weight as easily as anybody else, but this is what I do. I mean, if I don't have the skill set to eat well, who would? So I do. So I've eaten well my entire life. I've eaten a diet of whole plant foods and very little of anything else. And the result is I fill up on a healthy number of calories. They count, but I don't need to count them. And frankly, neither do you.
So, given the addictive nature of so much of the food that we're eating, leading people to be addicted, how do people get off of such food?
So I coined the term many years ago, taste bud rehab. So unfortunately and fortunately, one of the most potent drivers of dietary preference is familiarity. It's unfortunate because if you're familiar with a junk food diet, you're going to prefer that. It's fortunate because you can become familiar with a healthier diet and learn to prefer that. What's the evidence that familiarity drives taste preference? Well, we actually have lots and lots of research on the topic, including evidence in neonates showing that the maternal diet during pregnancy, and for that matter, lactation, influences food preference in the newborn. So there's actually some delivery of nutrient components in utero that start to shape taste preference at birth. Really, really interesting. But we also have the evidence from culture. So, you just look around the world, and Mexican babies grow up and learn to like chilies because that's what their families eat. And Indian babies grow up and learn to like curries because that's what their families eat. And Japanese babies grow up and learn to like raw fish because that's part of what their families eat, and on it goes. So that's not because we're biologically different. That's not because taste buds differ. We're exactly the same. We're all the same kind of animal. We're all Homo sapiens. We're all part of one big extended human family. We're all very close cousins, but our cultures are different. Familiarity is a major driver of taste preference. So if you go from what you're familiar with and consequently prefer to what is unfamiliar, and you do that suddenly, you need to be prepared for a shock to the system and willing to put up with it, the cold turkey approach, and most people are not. So the alternative would be, okay, look, you eat way too much sugar. You eat way too. You're a typical American. You're soaking your taste buds in sugar and salt and chemicals every day. We need to fix this. So let's fix it by starting to make changes you will not find very objectionable. So let's start with sugar, for instance. Yeah, there's sugar in your dessert, and you care about that. And there's sugar in your soda, and maybe you care about that. But did you know there's sugar in your salad dressing? Because you probably don't care about that. And there's sugar in your pasta sauce. In fact, most commercial pasta sauces, marinara sauces, have more added sugar than ice cream topping. And I'm talking about a direct comparison of the grams on the label. It's unbelievable. So you are unaware of that. You don't need a marinara sauce to have added sugar, for crying out loud, right? You don't mind buying a different marinara sauce that doesn't have the added sugar, that costs the same and tastes as good, right? So what I did with my patients over the years was start with stealth sugar and stealth salt. In other words, take it out of foods where it was hiding, where sugar was masked by salt and salt was masked by sugar, where you're not going to really miss it. But we can start there and start to titrate down your exposure by many grams a day. And with each incremental reduction in your exposure, your taste buds become a little more sensitized. And if we give them a few weeks to come out of their coma, all of a sudden the dessert you used to love is going to start tasting too sweet, and the soda you used to like to drink is going to be a little too sweet. And at that point, a few weeks in, we can say, okay, now let's start moving from the stealth mode to those foods that are sweet, and let's start dialing them down and making substitutions. And so in an incremental approach, you give your taste buds time to adapt, you give your palate time to recover. I call that taste bud rehab. Same with salt. So Pasta sauce literally may have more added sugar than ice cream topping. Breakfast cereals tend to have more added salt than anything in the salty snack aisle. Why don't people think of breakfast cereals, Cheerios, as a salty snack? Because very often, particularly kids cereals, there's so much sugar it masks the salt. You're just not perceiving it. And so it's there, it's stimulating your brain, but you're not consciously aware of it. But getting rid of salt in breakfast cereal is pretty easy to do because most people are not eating breakfast cereal as a salty snack in the first place. So though there are lots of opportunities to trade up within a category of food, to do it incrementally, to give your taste buds time to adjust, and then to make additional changes. And at the end of as little, usually is about 12 weeks, you can completely transform the diet. And studies show, including randomized controlled trials, that after that period of habituation, people actually develop aversions to things they used to crave and cravings for things they used to have aversions to. So it's very, very powerful.
All right, so we have about 9 minutes left. So I'm going to let the audience ask a couple of questions here. Evelyn C., state where you're from and ask your question, please.
I'm from Albuquerque, New Mexico. So you're talking about your test measuring 200 nutrients. And I agree that most people won't accurately track their food intake, quality and quantity. But if I really took a lot of personal responsibility and I went on the Chronometer app, which I've tried, but I kind of only did it for about 2 weeks before it was too much homework, basically. But how do you feel about that app? If you are brutally honest about the quality and the quantity. So, like for me, I can put in that I'm having potatoes, but I think the real downfall is that I'm having potatoes fried with oil, let's say. Um, and I'm not sure how that app tracks the quality versus quantity problem. So my second question is about if you could talk about people chasing nutrient deficiency with supplements without first changing their food, and whether you think that we really do need some basic supplements because of the poor quality of the soil, that we should be getting minerals from the soil, but what not. And my third question is, do you tell your practitioners to test nutrients with serum or intracellular testing?
Okay, thanks, Evelyn.
Okay, so I have not been in a position to micromanage the assays for nutrient levels, but to the best of my knowledge, most of the measures are serum or plasma rather than intracellular, just because of the cost of the assay. So when we've done research and published papers, the assays have been fairly standard assays used in clinical practice, for example, at credentialed labs around the country to look at biochemical markers of nutriture. So I don't have much to say on that topic. On the topic of supplements, I think the critical point to make is in the name, supplements, not substitutes. So if you're implying that we too readily turn to supplements and fail to address overall diet quality, I'm inclined to agree with you. So often it's a cop out, basically not worry about my diet and just take a multivitamin. It's kind of how we roll in America. And I'm not talking about this audience. One of the challenges, right, in having these interactions, inevitably, when you're talking to people who come to a nutrition conference, you're much more enlightened about nutrition than the population at large. But most people will blithely take supplements and have them be a substitute for eating well. Very bad idea for many reasons, because of the powerful impacts of overall diet quality, but also because we don't even have names for all the nutrients that matter, right? I mean, there are thousands and thousands of phytochemicals in plants. Some of them are essential nutrients, some of them are non-essential nutrients, some of them we don't know what they are. And we certainly don't know how they all interact with one another, but all of that's probably important. But so supplement, not substitute. But you're right, that there is evidence that the changes in the planet, the changes in the soil can translate into declining levels of nutrient concentrations in foods. We obviously have soil that is routinely deficient in B12. And as a result of that, plant foods are very low in B12. And as a result of that, if you have a plant exclusive diet, you are apt to be relatively deficient in B12. So when we identify specific shortfalls that are not readily addressed, with an appropriate focus on overall diet quality, then I have no problem with judicious supplementation. In fact, one of the advantages of what we do at Diet ID is we actually measure your approximate intake of 200 different nutrients from food. So we can identify where, despite your current dietary pattern, are you like to have nutrient shortfalls. And we can recommend personalized supplements to make up those gaps. Now, if we can fix them by improving your diet, great. If some of them are going to persist even when you get your goal diet, that would be an argument for long-term supplementation, whether it's vitamin D or B12 or something, or omega-3s, for example, especially long-chain omega-3s. If you are plant exclusive, you may be able to get ALA into your diet, but you're going to have a heck of a time getting lots of DHA and EPA unless you're eating a fair amount of algae. So, for example, I take an algae-based supplement. I don't want to be eating fatty fish routinely, so I want to get it low in the food chain, sustainable source. I take an algae-based supplement, and I think that's a prudent thing to do. So I'm perfectly fine with judicious use of supplementation, but it's supplemental to, not substitution for, a focus on a healthy diet. And yes, about depletion of soil, and obviously that's a problem. And then your other question about chronometer and yeah, I mean, it's not that it's impossible to get good information about diet by tracking diet. It probably is impossible to get good information about dietary intake from recollection. So food frequency question is remembering how much of what you ate over the past 3 to 6 months. I think that's intrinsically inaccurate. And 24-hour recalls are too subject to spin. So, inevitably when you ask people what they ate yesterday proves to be a particularly great day. But this is different because with Chronometer or MyFitnessPal or a 7-day food journal that you submit to a dietitian, you're writing down what you eat as you eat it. Now, the accuracy of that obviously depends on the granularity of the interface. So if Chronometer asks about potatoes but not how they're prepared, you're losing relevant detail there, and you're absolutely right. If you eat potatoes that are cooked in butter or cooked in olive oil, two very different things nutritionally, and the bulk of the calories actually may reside in the added spread or oil rather than in the potatoes. So, I mean, depending on how they're prepared in a particular sauce, it might not really be potatoes with butter sauce. It may be butter and, oh, by the way, potatoes, right? And so that's really important. That sort of thing can be missed if you don't have high fidelity interfaces. Most of the apps that are tracking diet are pretty granular and do get to how the food is prepared. So if you give honest answers and you give them in real time, that can be perfectly accurate. So I'm not saying that's inaccurate, but as you noted yourself, it gets really tedious and you stop doing it. And most people aren't going to do it in the first place. So it's kind of, the analogy would be that intra-arterial catheter to get your blood pressure. Yeah, we can do it. It's just going to hurt like hell. Most people are going to say no. So it doesn't work at the population level. It doesn't work for the general population. It doesn't work to make diet quality a vital sign. If we want to do that, we have to make it both accurate and quick and easy and effortless and even fun and passive. And that's what we're trying to do. So yes, those work. But as you saw yourself, it's pretty tedious to hang in there.
So one of our participants is asking, people want to get involved in helping educate other people. Are there any places to, obviously there's the idea of people going to, you can take T. Colin Campbell's course and then go become a nutritional coach. Are there any places that are hiring people to get a job in this field to help spread the word, or just you have to go out on your own and do it?
No, there definitely are. I mean, if you have some credentials, I've been involved over the years with the Institute for Integrative Nutrition, and frankly, I've seen many of the graduates go on to do really great things, innovations, entrepreneurs, develop companies, develop apps. So some of the innovations are digital, some are other. So they've basically been trained as health coaches. I'm a big fan of Well Coaches, the work of Margaret Moore and others. So you can obviously be a fully realized health professional, but that's years of effort. You could be a dietitian, years of effort. But people are getting training in nutrition and health coaching and combining that with their native aptitudes and passions, whether that's for one-on-one interaction and they're being a coach or some sort of instructor. I mean, you could be a yoga instructor who makes a real effort to learn about nutrition, and you talk both about caring for your body with the movement and nourishing it well, and you could be paying it forward that way. Or if you are inventive and maybe you're an engineer, but you're interested in health, you can combine that aptitude and think about innovations in the digital space, in technology. A lot of people are doing that. So I think there are lots and lots of ways we can all pool our talents and our passions to make a difference.